We're going to talk about fibromyalgia, which is the complex condition that affects some of the patients in my practice, but many people in the United States and in the world. And it's kind of a in conventional medicine, I would say it's kind of a basket diagnosis. If the doctors cannot find a specific reason, they just say, oh, it's a fibromyalgia. Or if people just have this pain, diffuse, widespread pain, and the patients are diagnosed with fibromyalgia, there's not really much they can offer, but there is an existing, except for the pain medicine, okay, of course. But let's talk about how we can help in the functional medicine approach. So we're going to start with talking about the agenda for today, and we're going to speak what is fibromyalgia, what are the symptoms of fibromyalgia, and what are the causes, possible causes of fibromyalgia, the treatment options in conventional medicine as well as in a functional medicine. I will present a case from my practice, one of the cases of fibromyalgia, and as well we're going to talk about MSK, or musculoskeletal pain recovery program that we offer in our practice. So as you probably know, fibromyalgia is diagnosed based on this painful or trigger points, painful spots in the body, and it should be 11 out of 18 painful spots or painful points or tenderness points. That is a part of the criteria. This criteria include many other symptoms, but the pain should be around this 18 or 9 pairs of points. So if it's there, 11 out of 18, you kind of qualify to be named as a fibromyalgia patient. So, but in fact, fibromyalgia is a not just chronic condition, but it's a conglomerate of variety of the symptoms. Some of them will be fatigue, but also pain, according to the chart that I just presented to you. 11 out of the 18 trigger points across the body. And interestingly enough, women are much more prone to develop fibromyalgia or being diagnosed with fibromyalgia than men. But there's a plenty of men who suffer from this debilitating condition that is usually chronic and really disabling. So people are really suffering through it. But it is actually a conglomerate of the symptoms. So the widespread pain, fatigue, debilitating fatigue, not just like, oh, I'm tired by the end of the day and I just want to go to bed early. This is the fatigue that people cannot even get out of the bed in the morning. Brain fog to the point when people cannot really even function. They cannot maintain the job. They cannot work. They cannot do basic executive functions, and could be associated with the headaches and migraines. And of course, when people are so sick, there's definitely emotional component to this presentation. So emotional symptoms will be almost always inevitably there. Not just depression, but also anxiety, this misunderstanding of what is going on with me. Why am I so sick? Many young people are suffering from fibromyalgia, and it is debilitating because they're missing the most productive and most fruitful years of their life. So it is imperative to diagnose it earlier and dig deeper to understand why this is happening to people. And that's where functional medicine looks at their also some of the typical functional medicine syndromes or diagnoses, like SIBO, or small intestine bacterial overgrowth, which connects the gut with all this variety of different symptoms, and variety of their systems that are involved into the process. So central nervous system in the form of the brain fog or headaches, that involvement of their neurological symptoms, but as well as fatigue, and that involves mitochondrial function, right? So it's definitely a disease that connects multiple organ systems. It's not just one system. And we know from the studies and basic research, we know that fibromyalgia has a really strong involvement of the brain. So it's initially starts with some tissue injury, as you can see here, and that will start this inflammatory cascade in the form of the cytokines or mediators and the molecules that communicate the message about the pain. And through the pain receptors, the message is sent to the spinal cord, and the spinal cord will send the message to the brain. And that's where the message from the brain becomes really amplified, and through their spinal cord going back to their through the biofeedback or the loop of their messaging from the brain to the spinal cord. Now the message goes to the musculoskeletal system, or the muscles and ligaments and tendons, where they release a lot of painful neurotransmitters and cause more inflammation and histamine release, one of the neurotransmitters that potentiate even more inflammatory messaging that kind of closes the loop, and this message is going on and on and on. The message from spinal cord can also go through the pain neurotransmitters into the blood vessels, and that's when people may experience redness, heat, swelling, and lack of oxygen delivery or lack of nutrients delivery. But so as you can appreciate from this diagram, that the initial message could be significant or not significant, but because this gets involved into the brain and through the whole loop or neuromuscular connection, this becomes amplified and perpetuated. So how is it diagnosed? Usually there is a painful trigger points on the body according to their diagram that I just showed you. And definitely the duration of the symptoms and painful symptoms are not just for a week, it's usually 6 months plus. So this symptoms last for a long time, people suffering, they're going from doctor to doctor, they get some evaluation, all the markers are usually normal or semi-normal, but then we are also finding that there's some markers of mitochondrial health that are abnormal, and patients will ultimately be very depleted from all these painful syndromes, and they become depressed. But what we really want to look at their variety of the system that are involved with. We diagnose it through their ruling out infections. And people with fibromyalgia commonly have a lot of chronic infections, and these infections can be anywhere. It could be teeth, it could be sinuses, it could be chronic gut infections, tick-borne illnesses that are going for years and years being undiagnosed. So, and the chronic viruses are also very, very prominent in this patient. So, but infections could be only a part of the presentation. Could be involvement of hormonal system, like cortisol depletion, or mitochondrial health depletion. So all of those symptoms and systems need to be properly evaluated and included into the treatment plan. So in conventional treatment, as you probably know, there's not a lot of treatment modalities. So there's going to be pain medications like opioids, and we all know that we have this epidemic of opioid crisis in the country. So, but still, if people in pain, doctors will attempt to help and alleviate the pain with some of the medications that could be harmful. Interestingly, the anti-inflammatory medications like non-steroidal or steroidal medications will perpetuate their painful and inflammatory loop. So they will relieve the pain symptoms for a while, but they will delay the healing or resolution phase of inflammatory response. So it kind of helps initially, but then it leads to this chronicity of the inflammatory problems. Of course, there's antidepressants because people getting chronically depressed and anxious, but also muscle relaxants also can be helpful. But all of those approaches are kind of like Band-Aid approaches. They're not really looking at the root cause of their fibromyalgia. And that's where the functional medicine really shines, because we have not only non-addictive pain therapies in the forms of supplements and nutrients and herbal anti-inflammatory and pain relieving medications, but we also focusing on resolving mitochondrial dysfunction, and with supporting their messaging between the body and the brain, which is really important, as you appreciated from the diagram presented earlier. It is so important for these patients to include emotional therapies and addressing their painful or traumatic event that can be triggered, the onset of fibromyalgia, and also can be perpetuating based on their subconscious and their emotional trauma that was maybe occurred in the childhood. So in a lot of times in my practice, people with the chronic painful syndromes, including fibromyalgia, they might have a triggering event. It could be motor vehicle accident, or it could be some traumatic brain injury, but then they can recover for whatever reason. And then commonly they have some emotional events in childhood that needs to be addressed for them to start healing. So all those things kind of seen in pack. And the beauty of functional medicine is that we are really treating the combination by addressing nutritional balance, physical balance, and psychological balance in to help people to achieve the optimal health. So as you can see in this diagram, it's not just symptoms. We really need to address nutrition, making sure that physiological resilience is supported, metabolic reserves of the patient is supported, the gut health is addressed, and patient's diet is addressed with anti-inflammatory foods, removing all their possible inflammatory triggers from the food, hydration, inflammation is addressed, and removing the toxic exposure from the patient's life, which is so common, especially in industrial centers like New York City, or cities that have so much pollution. But we also evaluating the physical balance. I routinely recommend for patients to get evaluated by physical therapists or chiropractors or acupuncturists or osteopathic doctors, whatever works for you, massage therapy, because physical balance is so important. And movement, any movement you can maintain or afford physically, because these people are so fatigued that sometimes even basic walking can exhaust them. So this is really important for people to address that. And psychological balance, as I mentioned, is really important. And we'll talk about some of the options that we offer to our patients. So here's the typical case. And actually, Sean was a patient in the practice. He was 44 years old, and he's been experiencing this chronic pain and chronic fatigue. It's just kind of without any specific trigger. He didn't have any traumatic event. It just slowly, little by little, he started developing pain in these multiple spots in the areas of his body with no clear cause. So he, of course, he saw his primary care doctor, who ran standard testings and offered him pain medications and antidepressants. So Sean kind of said, well, let me wait for the test results. I would like to see what's going to show up. But test results came back unremarkable. So his doctor said, this is definitely maybe due to the stress, it's all in your head approach. Let's put you on the pain medication and go see psychiatrist. So Sean, kind of being educated and motivated patient, said, you know what, I'm not going to look at the pain medications because I know about addiction, and he did have a history of addiction in the past, so he was really cautious. And he knew also that medication can prevent the tissue healing. So he said, I would like to look at the alternative. So he found our practice through his friends. And we did the very thorough evaluation and also very specific testing that we do in functional medicine. We looked at the organic acid test. to evaluate his mitochondrial function. We look at the micronutrients testing, the blood test that looks at the intracellular and extracellular nutrients to see what is the nutritional status and how supported or depleted patients are. We looked at the stool test to evaluate his gut health, hormonal health, to evaluate his cortisol as well as testosterone and other hormones that are so important in the process of inflammation. We look at the microbial panel that we usually do in the office to evaluate for the microbial burden for the viruses, tick-borne illnesses, and other pathogens. And we did also food sensitivity testing. This is a non-exhaustive list, but we usually pick 1 or 2 tasks to start with. And if we don't find any answers, we move on into other testings. As we corrected all those abnormalities in a very individual way and individual approach, including diet, nutritional, and therapeutic intravenous treatments, and we addressed his lifestyle, he actually started feeling better, and he actually recovered from his fibromyalgia, but he has to be careful. He knows his limits, and he knows that if he's gonna go and party next day, he needs to recover, or if he exercises too much next day, he does need to recover a little bit longer. So he also learned from this approach his limitations, which is so important for many of us. So we do utilize a variety of the modalities for treatment of the pain and fibromyalgia, including acupuncture, cold laser, biomagnetic therapy. We use this pulse electromagnetic field therapy technology in the form of on-demand, which is a great way. We're going to talk about it briefly. And body work like chiropractic, osteopathic, or craniosacral therapy, massage, all of those things should be in the routine of healthy people as well as people who are currently in troubles. We also utilize ozone and UV light therapy, which are absolutely indispensable for treatment of infections and chronic conditions. So just want to say a few words about the musculoskeletal pain recovery program. What it involves, it basically starts with the discovery call with my team, and we see if it's a right approach for you, if you're ready to make their interventions that we offer and ready to change your lifestyle, incorporate the diet, and maybe understanding what drives the illness and optimal health. So then we meet for the very detailed interview, and after I review a very detailed questionnaire, we order a test that are specifically chosen for your story. It's not one size fits all. Every patient's individual. Every fibromyalgia case is very individual. So we have to sit down and spend time to looking at your story to understand what you need, what test you need. Some people need gut test. That's going to be their beginning. For other people, we need to look at the mitochondrial dysfunction. For third people, it could be micronutrients that will be a game changer if we improve the nutritional status. And then, of course, our patients will get some homework and some additional education so they understand why certain treatments are recommended. So there's a lot of education. My patients will work with a health coach to understand and implement one small step at the time of the program that I will prescribe. And then there will be some follow-up appointments and follow-up testing if necessary. So working with a health coach is really a big game changer for my patients to implement it, because for some people, it is first time when they see the prescription of the diet from the doctors, right? So how do they start? Where do you start? How do you implement all of that? All of that people need to have a multiple point of interaction to stay motivated and implement the prescribed treatment plan. And so that's basically our approach. I want to really introduce my recent development. This is my first digital program that I developed to educate people in the most affordable way uh, how you can help yourself to improve your gut wellness. So this is educational tool to understand that the gut is the central hub connecting the rest of the body from the functional medicine standpoint. So this is their digital program, 4 modules program, that is balanced on that is based on understanding of the basic concepts of digestion, as well as functional medicine approach to healing the gut. We talk about not just condition like reflux, but we also talk about what is leaky gut, how is leaky gut linked to autoimmunity, and how treatment of the 4R program, for example, can change and improve not only your chronic condition, but also improve your overall health. So if you're interested, we are offering this early bird special. It's only $99. You'll get there, several hours of me teaching you what is gut health, and it's a great way to start for the patient. Sometimes when they're not ready to come and see me in person, they start with that. When they go through the program, they understand how to implement the changes. They actually start dabbling around with the diet, either elimination diet or detoxification diet. And then when they choose to follow with a functional medicine practitioner, me or someone else, they will be so much more educated and motivated, and the expectation will be in the right place. So this is a really great way to start. This is do it yourself, $99, really great way to get your feet wet with the functional medicine. So we also, as we launching this whole gut wellness program, we are launching the Instagram broadcast channel where we'll be recording brief tips and instructions for people how to live healthier life. So if you want to join, just scan this QR code and join our broadcast channel. Just to give you a little sneak preview, we will be doing the same whole gut wellness program, but with group sessions, weekly group sessions with my health coaches and with myself and with another practitioner in the practice, Marina Butcher, who is a physician assistant. So that would be a really great way to learn and then connect to the group, create community, ask questions, get the answers right on the spot at the very affordable way. So stay tuned for announcements. And I always like to use this opportunity to invite more people to do the fasting mimicking diet with me. My next round of 5 days fasting will be from October 7th to October 11th. So put it on your calendar and join me. We'll be supporting you through maybe group coaching and live event. I am doing it. It's probably my 25th round of Prolon. I love it. I love to do it not just to maintain my body weight and reduce the inflammation, but also to stimulate autophagy. They're basically one of their most important, in my opinion, processes that your body can do the cleanup, self cleanup. Autophagy is self-eating. So this is a great and indispensable way of rejuvenating your body and healing your body, as well as reducing inflammatory impulses and stimulation from the food. So 5 days, everybody can commit 5 days, but get ready, put in your calendar, and please join me. And if you want to get the best price of $148, we're sharing our professional discount with all our clients. And because you're here on this call, you can get that as well. Scan this QR code and order it. And just let me know that you want to join the group. So yes, that's just explanation of what this 5 days fasting mimicking diet includes. It's a 5 boxes in this big box, and each box dedicated to each day. It's pretty easy to do, and especially with the support that we're offering. And if you're really specifically interested in musculoskeletal pain recovery program, feel free to scan this QR code and fill out the questionnaire and send it to us. And order the discovery call with my team, or follow us on the Facebook or YouTube channel to communicate. Stay tuned with us, and because there's much more information coming, we're trying to educate all our subscribers with the updated information. So just a couple of announcements. We still run our promotion for new clients. You have to be existing client to get this special for the nutritional IV drip. So we do have a IV suite for those of you who haven't been in the office yet. This is what we have. And a few words about this pulse electromagnetic frequency device on demand. This is a German technology, very sophisticated electromagnetic field therapy, which is gaining more and more popularity. Some people are very sensitive to the supplements, or they don't want to take supplements. This is basically external impact with a specific frequency that your body's craving, and we diagnose you before we're delivering this frequency, but it has a exquisite effect on the healing potential of the body. So it also can help us to treat chronic infections, as well as potentiate the function of the variety of organs and systems. So if you're interested, and if you are a patient, feel free to request a free session, introductory session with our health coach, Emanuela Vizzoni, and she is a practitioner who runs this unit in our office. Or if you are not a patient yet, or you just want to experience it, you can always ask for session for a discounted price. So if you're new to our practice, pick up the phone or just click on their Calendly call link and book the time with one of our team members. And you can ask all the administrative questions in that discovery call, usually 15-20 minutes. People at convenient time for you, convenient time for us. We do it almost daily, so just feel free to book that discovery call. And if you are our patient and you did your genetic test, I'm reminding you that this, every last Monday of each month from 12 to 1, usually it's a lunchtime, we run a genetic testing support group, which is absolutely phenomenal way to learn about your genetics, learn about your strengths and weaknesses. And many of the people who are on this call are my patients. So this is just a friendly reminder. Please attend this group the last Monday of the month. We also, in October, we're running our introduction to mold and toxins. So feel free to sign up. It's a free session. We try to run as much as possible educational courses for our patients for free. So just keep it in mind. And then, of course, if you are already a patient of the practice, feel free to refer your patient to your friends, because friends don't want friends to go to the bad doctors. They want to go to only the best doctors. And based on our review, I think we are pretty good at what we're doing. So feel free to review to check our reviews online. Basically, I am working with a physician assistant, but I'm supervising every case with her. We discuss the cases on a regular basis. So I like to keep my eye and ear and my hand on the pulse of every case that is going through my practice. Maybe it's like micromanagement, but that's what I like to do. Okay, well, thank you so much for joining our live Q&A today dedicated to fibromyalgia. If you would like, visit my medical store and you can get 10% off today, site-wide. Any item you like and pick, you can get their discount, 10% discount, by using this code QA10SEPT, SEPT.